yeah. Let it shine on you, yeah. Let it shine on you.
Hello everyone, my name is Cyn Abrams, and I'm the host of I Followed My Dreams. When I created this webisode series, I knew I wanted to create a platform that allowed for open discussion on HIV and AIDS. And on today's show, we're doing just that. I have the honor of speaking to Ms. Dazon Diallo, who is the founder of SisterLove, the first HIV/AIDS women's organization in the southeastern United States. So join me, your host, Cyn Abrams, for I Followed My Dreams, as we discuss this epidemic that's impacting our community every day. Hello everyone, my name is Cyn Abrams and I am here with Dazon from SisterLove. We're going to kick off our interview with a question from our life box. So you have to pull a question and then you have to answer it.
Okay. Do I have to tell you what it was just in case I choose not to answer it?
You have to be honest.
Okay. I'll be honest, I just chose something else. Okay. How did you celebrate your 18th or 21st birthday? Wow, let's think. I'm going to pick 21.
Okay.
Because what's really funny is right now, even when people are talking about youth and age and that sort of thing, I tell folks automatically, I'm 21 and 26. So I'm a youth twice, and I'll probably be a youth a third time before this is all over.
That.
And if God is righteous with me, I'll be a youth at least 4 times before this is over.
So what did you do?
So for my 21st birthday, my mother is hipper than I am, and she has pierced ears like all the way around. I've had my holes since I was 6 weeks old. And so for my 21st birthday, I said, okay, I'm going to be, you know, my mother likes going to the mall and getting pierced and shopping. And so I said, okay, I'm going to get my ears pierced.
Yeah.
Because I just want to know what it feels like. I'm 21. I can handle it.
Yeah.
1 pierce. And I was like, okay, I'm done. That's enough, and I don't need to do another one. I know I'm 21 now.
So you let your mama get more holes than you?
She got more holes than me. And she even got 2 holes in that sitting. So yeah, no, that's what I did for my 21st, was just to spend the day with my mom and try to be more like her. And I'm still not complete.
Well, sweet. That's all right. You know, we grow into our mothers as we get older.
And that we do. That we do.
But I'm glad that we kind of started off in your 20s because you started SisterLove over 20 plus years ago. And when you started SisterLove, I know that the HIV/AIDS crisis had already begun. But where was it amongst the Black female community?
That is such a good question, because what people know and what was real are totally 2 different things. I actually was in the reproductive health field first.
Okay.
And so I was able to see from, you know, the sexually transmitted diseases and the unprotected pregnancies or the unintended pregnancies that were happening, was that whatever we knew about AIDS and men, because my first thought was, well, you know, gay men have sex with men.
Right.
Straight women have sex with men. So for whatever risks are posed to gay men, they must be posing to women. And so that's what raised my question at the time, when there were no reported cases in 1984, 85, when I first started volunteering, at least in the South that I knew of women diagnosed with AIDS. But the more we got involved, we started finding these women who had nowhere to go, no one to call, no services to tailor to them. And we knew that there was a hidden epidemic that not even the public health sphere knew about, because they were so focused on the big parts of the epidemic with people dying so fast. So where we are now is we are still in an era where, while we do know that whereas in the late 80s, women were about 7% of the epidemic, in the early 2000s, now in the mid 2000s, that or the 10s, that we are at least 25% of the epidemic nationally, and in some places at least 30% of the epidemic, including around the South. So I think where we've reached now is, we know we have the numbers, but have we caught up with the rate of the epidemic in women? No. Have we caught up with the comprehensive service delivery that women need uniquely because we are women? No. And are we thinking down the road forward, if we're really trying to get to the end of this epidemic, that we are inclusive of all of these issues with women? Because while we might only be 25% of the epidemic in the US, women are 51+% of the epidemic in the world. So if you don't address this epidemic for women, we will not end AIDS.
How is Sister Love addressing this epidemic?
Well, because we're a little organization or a small organization that does a lot of big things, we're addressing it from as many angles as our capacity can handle. We have been involved directly in education and prevention interventions that we create ourselves. The Centers for Disease Control recently helped us do a study on our own interventions and determined that we are as effective and have as much impact in helping people reduce their risks as some of these big institutional level types of interventions. Which is huge. We get directly involved in building the leadership of women and their families to address HIV, especially for those who are living with HIV. So we create videos, we hold workshops, we get involved in the advocacy end of it, talking with legislators, with leadership, with other organizations. We're building across the bridges to issues around homelessness and housing and poverty and equal pay for women. Everything that's tied in to a national agenda around improving women's health outcomes. We're making sure that HIV is always front and center, because for Black women in this country, even though we are dying of cardiovascular diseases faster, and that's our #1 issue. We're dying of diabetes, we're dying with cancer. Unlike any other population of women and people in this country, we're dying of AIDS faster and quicker than other groups are, including our men. So it's really, really important for us to get a handle that we have. And we've never not been a part of the epidemic, so let's get that out of the way. It's never been a gay white men's epidemic, never. And we now are significantly a part of the epidemic to the point where people cannot act like it's being taken care of.
Let me ask you this. If I come to you and I say, Dazon, I just found I'm HIV positive, what do you recommend?
So there are two things I would say to that. One is, I would hope that you came to us to find that status, because we do testing and counseling, and we do help people get linked to care or linked to other preventive services if they're not positive. And if you found that out with us, the first thing we're going to tell you is sit with it for a minute and learn as much as you can about it. Figure out what you need to say about it, because at some point you're going to need to tell somebody, even if it's your pastor, even if it's a doctor, even if it's family members. Sit with it, think about it, and then figure out who you're going to tell and why. Because if you don't do that, it'll be a long time before you even think about seeking services or getting help.
For people who don't know someone that is HIV positive, or a female that's HIV positive, what would you say in your years of working with women who are HIV positive is their biggest need? Is it love? Is it access to health care? Is it understanding? Is it compassion?
The biggest need for people living with HIV, for women living with HIV? The first thing is, do not stigmatize. Do not. And that means, in a lot of different ways, you don't discriminate, first of all. But it also means that you do not automatically set somebody's humanity aside because they're HIV positive. And you still have empathy, and you see them as yourselves, because, you know, it could be you. Maybe but for that one time you thought that you should use the condom, right? So it could be you. So that's the first thing. The second thing is, then you should know as much as you can, so you can educate and help somebody else get into services. You should automatically be able to say, girl, I know where there's a clinic, I know there's a phone number, because that's what you want to be for somebody. They don't want to be invisible. And the other thing is everybody is, because of the shame that comes with it, the first thing we think is, it's just me. Why me, and why only me? And so people need to know you are not alone in this at all, ever. And if there's anything you need, navigating the system, talking to somebody, getting somebody to talk to, sharing it with other people that you're afraid to share it with, girl, call me, I'll help.
I've always grown up in a world with HIV, and I've known about it my entire life. I think the first time I became exposed to it was, believe it or not, through MTV. They started a series called True Life, and I remember watching people on there who were HIV positive and telling their story, and so I've always been aware. And our generation, we've seen it on ads on BET, we've seen the poster, we've seen the billboards. But I was reading an article in the Atlanta Journal-Constitution last week, and it said that 1 in 16 black men and 1 in 32 black women will become HIV positive during their lifetime. Now, the CDC has done a lot. You're doing a lot. Other organizations are doing a lot. How can we eliminate it? Can we eliminate it? Can we bring those statistics down in our community and across the world? And if so, how?
Absolutely, we can. There's another piece of information that the CDC has released for us this summer, which I think is an excellent tool for us to figure this out. And they now call it the treatment cascade. What we know, and I'll say these two things, the science has now shown us that people who are living with HIV and get on their medications and are adherent to their medications can actually suppress the virus till it's not detectable. If a person suppresses their virus to an undetectable state, they are 96% unlikely to transmit the virus. That means if all the people living with HIV got their access to their medicines, and they stuck to their medicines, then we could end this epidemic by almost 100% of them being safe.
Access to their medication.
Access to and adherence to. You know, it's just like a lot of us, we even try and be adherent to vitamins every day and can't. So imagine a lifelong drug that, you know, that's a challenge that you have to take every day that may have some side effects that don't agree with you, but they're saving your life, so you have to figure it out. So that's huge that we can get to that. But the way we're going to get to that is, first of all, everybody's got to know their status, because if you don't even know your status, how are you going to get into care? If you don't get into care, how are you going to get access to the drugs? And if you don't stay in care, how are you going to stay adherent, right? So that's the first thing. Everybody's got to get tested to know their status. If we got people in our community who are still walking around and don't know what their HIV status is, they're now a part of the problem. And I don't even care how much activism they're doing. If they don't know their status, they're not helping. The other thing that we have to do is make sure we're finding and continue testing and practicing safer behaviors. Let's be real. Now, I'm still at the policy level, so we also have to make sure that we're fighting every day like tooth and nail that everybody in the black community has access to the healthcare, education, and service delivery that we need. But at a very, very community and family and individual level, people have got to get a grip. People have got to understand that yes, HIV is impacting Black America and the Black world like no other population of people, and there's nobody else who's going to stop this but us. And so we have to get educated, we have to be able to talk with each other about it, and we can end this if we are all committed to it to the end. Not just, you know, come to the AIDS walk in October, but come to the AIDS walk in October and then go tell people why you were in the AIDS walk, and then mobilize people to learn more about it and to keep up with it. That's the only way we're going to get to this, is that people want it to end.
It is clear that this is your commitment, this is your lifetime journey. How did you become so passionate about HIV and AIDS? And when did you realize this was your destiny?
So I'm lucky or blessed, or a combination of both, to have just been in the right place at the right time to recognize that, and I'm an Aries, so you know we start things. To be in the,
hey Aries.
Yes. All of you. We're accused of not finishing things, which is why I'm in this fight. Right? I'm not going to start this fight
27 years strong
and not finish. Exactly. I'm going to be in it till it's over. But what really got me was that there wasn't anything happening for women in this town in Atlanta, and even at the local aid service organization, because all their people that they had been serving up to that point were men, almost all white men.
And this was in 1989.
This is in 1984, 85 when I first started volunteering. We formed SisterLove later, after just doing work in the community and just finding out that nobody's going to come save us if we don't save ourselves. Then we can get the help we need, right? So that's really, really what happened. It wasn't if there was a watershed moment, it was when, even working in a women's health clinic, I realized that even for those women who were primarily, you know, middle class and white and feminist, that this wasn't a priority issue for them because it wasn't impacting white women in the way it was impacting other women. And I'm just going to be straight out with that. It was, you know, at that time it was poor women, it was drug users, and that's not the typical population in a private nonprofit reproductive health center, right? And so that angered me, that we couldn't figure out a way to prioritize AIDS in our overall organizational priorities. And so that angered me. And the other thing that made me just really step forward and say, okay, let's do this thing, is that there was a whole community of women, Black women, from the community at the street level, leaders, you know, who were working in the mayor's office, who were working at Grady Hospital, or who were working as EMT, you know, emergency techs, who were like, because we had brought all these folks to say, what are we going to do? Who said, we have got to do something for ourselves.
So your advice to someone who's sitting out there who's saying, you know what, I want to start a nonprofit agency. I want to serve my community.
Right.
I want to do this, whether it's in HIV and AIDS or diabetes or breast cancer.
Yeah.
What do you say to that person? Are
you volunteering yet? Because the first thing I'm going to say is, are you volunteering? Because if you have great ideas and lots of love to give, you know, I can't tell you how many millions of nonprofit organizations there are that exist but ain't giving nothing. So before you think about starting all that, start with where you want to put your heart and volunteer that somewhere first. Give first. And then after that process, that will open you up to where you're supposed to go with that. I think the way Sister Love started is, I thought it was a mistake in the beginning, but I think it was sort of just organically the best way to do it. If you have an idea, if you have a program, do it. You know, find a home for it. Go talk to an organization, talk to a church, talk to a civic group, and say, I have an idea, I'm working with you, I'm volunteering, I want to try this out. Put the program in the community first, and then let the community own it. And once the community embraces it and owns it, then they will help you organize around it. I love that.
Start where your heart is and let the community own it.
That's right.
Thank you so much for talking to me. Do you feel like this is your legacy?
That's a good question, because I hadn't stopped to think about what a legacy is. This in its totality may not be my legacy. It may be, I don't know. But if making sure that the story of how the brave women who struggle every day to live out loud with HIV have secured their leading place in the world, in the story of ending this epidemic, if I have had anything to do with making that happen, then I will be satisfied.
How can people find out more about Sister Love and what you all offer?
Well, you know, we's all over the electronic sphere, or as Rachel Maddow would say, the internets. And so, of course, they can visit our website at www.sisterlove.org. We are also on Twitter. You can follow us, and you can follow me on Twitter, in the Twitterverse, as it were. And we're also on Facebook, and as I am, as well as Sister Love is, so people can like us on Facebook at SisterLove Inc. And of course, if you're in Atlanta, we can always use volunteers. We're right here in the West End, and we're on the West Side in Adamsville.
What do you need volunteers to do?
Just about anything and everything. And I will start with, because I don't think that money is number one always, it's number two. But people need to be able to give their time and their money and their love. And then there's a whole lot of work that you can put all of that to, whether it's helping us with our fundraiser. We have an annual event that we honor women who are leaders who've been living with HIV 20 years or more. It's coming up in October. It's going to be a red carpet affair. I'm very excited about that. We can use volunteers for that. Educators. People who want to go out in the community and teach others about what we're teaching them. We need folks who want to help us think through the advocacy strategies. We need, especially if you have professions, like if you're in media or if you're in public relations or you do graphic art design work, those highly skilled things that we can't afford, we certainly would love to work with people on. And we have a big platform. So even if you give us all your services, there are a lot of people out there who will be exposed to what you do. So your reward comes back to you tenfold, if not more, just by giving.
Well, we're going to stick around for an event that you're having today here, September 13th. So tell me a little bit about that.
So recently the International AIDS Conference took place. First time in 20 plus years that the conference came to Washington, to the United States, and it was in Washington. And just that new science that I was talking about earlier, there's a lot more. And so we're just holding a post-conference hub. We're one of the post-conference hubs for the International AIDS Conference. Community organizations around the country are giving opportunities for people who could not come to DC to that conference to get a flavor of what was happening. So we're getting ready to talk with the community about the outcomes from that and hone in specifically on some of the new science around prevention. So, and we're talking with providers, people who run health clinics, people who attend health clinics as patients, so that the whole community is getting this information and then holding the conversation together about where we need to go locally on some of these new things.
Well, we're going to stick around for that. Thank you so much, Dazon, for talking to me and our viewers of I Followed My Dreams. Thank you. And thank you to all the viewers for watching today's webisode. And like I always encourage you, like our Facebook page, I Followed My Dreams is the Facebook page, so that way you can become ingrained in our community and our culture of inspiring people to step out and take action for their dreams. And we'll see you next time. Thanks. Thank you. Thank you.
In December, the pharmaceutical company that currently manufactures and sells the drug Truvada, which is a combination medication for people living with HIV. It's been demonstrated in several different trials that when you use, the base of that drug is tenofovir, but when you use Truvada for people who are at high risk and they are HIV negative, if they take that same medication in a daily dosage, then meaning they have to be adherent, then they are increasing their chances of not getting HIV by really somewhere between 70 and 90%, depending on the population and the level of adherence, right? That's about the level of true protection with condoms when you don't use them all the time, right? When you use them all the time, it's much higher. But there's lots of debate and controversy about what this means, because we also know that if people who know that they're HIV positive get into care and get their meds and stay on them and are adherent, then they're like almost 100% unlikely to transmit. So we've got to figure out how to meet somewhere in the middle, because there are people who have the opportunity to stop the epidemic because they're positive, and there are people who have the opportunity to stop the epidemic because they're at high risk and making other options than all of this good please use a condom work that we've been doing for the last 30 years.
Let the sun shine on your face, and don't let your love go to waste. And now is the time.